Hello, my name is Catherine Shelton, and I'm enrolled in the Indiana State University LPN to RN bachelor's program, and this is my third health education project for community health nursing course, Nursing 444, and my topic is how to prevent hepatitis A and B among the homeless community. So learning objectives are describe how hepatitis A and B are spread, describe the signs, symptoms, and potential complications of hepatitis A and B, and describe ways to prevent the spread of hepatitis A and B among the homeless community. So before we begin, I do have a pre-test, and then we'll get into the rest of the presentation. So homeless rates are on the rise. In Portland, Oregon, they have experienced a significant decrease in affordable housing over the last decade. This has led to increased rates of homelessness throughout the Portland metro area. A survey was done by the city of Portland in 2015 and calculated a 14% increase in homelessness and counted a total of 3,801 homeless individuals within one night. A windshield survey of the Portland metro area would indicate an increase in homeless camps and communities and the population since that 2015 survey. There is an increase in health risks among the homeless population. This includes viral hepatitis A and B infections due to unsanitary conditions, increased IV drug use, needle sticks due to unsafe needle disposal, and unprotected sex. So how is hepatitis A spread? Hepatitis A is a viral infection that attacks the liver. The infection often clears on its own and typically does not require treatment, but in severe cases, it can cause liver damage. Hepatitis A is spread typically through the fecal-oral route, and this could be caused by inadequate hand washing during food preparation. So people often experience jaundice, dark-colored urine, nausea, vomiting, clay-colored stools, joint pain, and a low-grade fever with hepatitis A infections. However, some people do not experience any signs or symptoms. So homeless camps and communities are growing among the Portland metro area, and this puts members at a higher risk due to the increased unsanitary conditions and lack of clean water and soap available. And how is hepatitis B spread? Hepatitis B is spread through bodily fluids, including blood and semen. Infections can be a result of IV drug use, needle sticks, and unprotected sex. Symptoms of hepatitis B are similar to hepatitis A and include the jaundice, nausea, vomiting, fever, pain in that upper abdominal area where the liver is located, pale stools, and dark-colored urine. And hepatitis B does require treatment. If left untreated, the individual can suffer from liver failure, cirrhosis, or liver cancer. IV drug use is more common in the homeless communities and among the Portland metro area in particular. Also, many homeless camps do not have access to safe ways to dispose of needles, which puts the homeless at a greater risk for needle sticks and potential hepatitis B infection. So why should we worry about hepatitis A and B among the homeless community? The homeless population are at a higher risk, like we mentioned, of contracting hepatitis A and or B due to unsanitary living conditions, increased risk of needle sticks, IV drug use, unprotected sex. But that doesn't have to be the case because hepatitis A and B can be 100% prevented through the primary prevention of administering the hepatitis A and B vaccine. Although hepatitis A does not usually require treatment, like we mentioned, it still can cause liver damage, and hepatitis B is more serious and if left untreated can lead to liver failure. So through primary prevention, we can reduce the risk of liver complications, reduce the need for medical treatment and future hospitalizations in the homeless community. And so what can the community do to help? The goal of this health education project is to bring awareness to the city of Portland and community partners to provide primary prevention in the form of hepatitis A and B titers, immunizations, provide portable hand washing stations, and sharps containers to homeless camps and communities. Our plan is to work with local homeless shelters and churches that currently provide meals to the homeless to set up these hepatitis A and B titer screenings and immunization clinics. So we would perform the titer test first to see if the individual has immunity against the hepatitis A and or B virus, and if not, then we would go ahead and go forward with the immunization. So we are asking for the city and county for funding to assist with setting up these screening and immunization clinics and supplies. So during these titer and vaccine clinics and delivery of supplies to the homeless communities, we will also be providing educational presentations and materials to the homeless individuals. This will serve to inform the homeless population about how to prevent the spread of hepatitis A and B, why the vaccines are important, certain risk factors, and signs and symptoms of hepatitis A or B. And then we hope to ensure compliance with the vaccine schedule because it is a multi-dose vaccine by providing this education and incentives through the church meal programs. We're also planning to evaluate the effectiveness of our primary prevention program by researching city and county incidence rates of hepatitis A and B infections 12 and 18 months after completing this program. And I did want to include here what the hepatitis A and B vaccine schedule is, since I mentioned that they are a multi-dose vaccine. The hepatitis A and B vaccine can be given individually, but there is also a combination vaccine. So hepatitis A is a two-dose vaccine at 0 and 6 months, and hepatitis B and that combination vaccine is a 3-dose, so at 0 months, 1 month after, and then 5 months after. So a total of 3 vaccines within 6 months. And we understand that it might be difficult to have homeless individuals comply, and that's why we're hoping to work with the churches to give the homeless individuals that incentive that they can get a meal and also come in and get their vaccine as well. So here are some different resources for homeless individuals. The first one, Portland Street Medicine, is a resource for homeless individuals to access medical care. And then the others are just different shelters available for the homeless community in the Portland metro area. And here are my references. And I do have a post-test available to see what you learned from the presentation today. And I hope you found this informative. And we hope to go forward with this program to reduce the hepatitis A and B infections among the homeless community. Thank you very much.